Nikki, I'm so excited to have you on the Mind Your Hormones podcast. I've been doing your workouts since I knew I was pregnant, which at the time of this recording, I'm almost 24 weeks. So for a while now, and I just learned literally just so much from you, from your workouts, from your Instagram. I know my community is going to be obsessed with you, so I cannot wait to dive in. But before we get into all the nitty gritty, just introduce yourself, tell everybody what you do, kind of how you got into this space, like a little bit of a background.
Okay, well, hi everybody and welcome. That's a lot. We could do a whole podcast on how I got into this, so I will give you the short version.
Okay.
So I'm a mom of two. I went through IVF. For anybody, I know you focus on a lot of fertility stuff. So
Yes.
anyone going out there through that gong show, I have empathy for you. Been there, lived it. Yeah, I started, so I'm 41 now, and I started having kids at 36 and 38, but I was doing this work in my mid 20s.
Wow.
So I was a dancer, injured my knee, discovered Pilates, started teaching at a rehab facility, started getting a lot of, pregnant women coming, and I realized that they needed their own thing. And so I sort of was like, okay, well, why don't we just make a class with you guys?
Yeah.
And then we'd get together and, then they would have their babies, and I realized they needed their own class. And so it sort of grew organically. And I started realizing that a lot of them were complaining of peeing their pants and making jokes about needing to wear a pad when we would do like jumping movements or boot camps. And so it came from this place of authentic curiosity, not, a lot of people in this space who are in fitness specialize in pregnancy and postpartum after they've had a baby because they realize the lack of support. And I
Yes.
think I clued into that lack of support much sooner in my mid 20s. And I started thinking, I want to specialize in this. I knew I wanted to have kids one day. And so that's kind of how it started.
Yeah. Oh my God. I love that. There is seriously such a need for it. And obviously that's why you're doing it. So can you just tell us why it's so important to focus on the pelvic floor and like what the pelvic floor is doing like during pregnancy, after pregnancy? Because like I never really focused, to be honest, I never really focused on it until I became pregnant. And I mean, I always did, like I did Pilates and stuff, but I guess I didn't realize I was supporting my pelvic floor. But I think there's just not really as much education around it. And the things that you said that people normalize, like, after you have kids, you're just going to pee your pants every time you sneeze and like things like that. I'm like, I don't want that to happen. Like, can't we please stop that? So what is the like reason why it's really important to focus on your pelvic floor? Specifically for pregnancy, postpartum.
Sure. So just for a little context, I want you to envision the fact that your pelvic floor is kind of like a basket or a trampoline. And fun fact, from the beginning of pregnancy to the end of pregnancy, your pelvic floor drops by 1 inch
Wow.
approximately. So think about it like a baby is like a watermelon bouncing on a trampoline. So you need to
Mm,
learn how to support the weight of that fluid, that blood, the placenta, the baby. Like it gets a lot heavier, obviously, by the end of pregnancy.
yeah.
So we have to temper that ability to strengthen and support with also this ability to be supple so it can open and make room for a baby to come out. So I
Right.
always want to make sure to understand, people to understand, your pelvic floor is a door that needs to open during birth. So the answer isn't to just do Kegels till the cows come home when you're
Mm.
pregnant. You need to also work on suppleness. So I call it supple strength. You need to, it's like that Goldilocks thing. It needs to be just right, not too tight, not too weak, right? Just right. Just like Goldilocks's porch, just right temperature, just right flexibility and malleability and strength. So, I mean, I can get completely nerdy on you here, but just as a summary here, the pelvic floor has 5 roles. So we call it the 5 S's. So
Mm.
I'll go over that real quick here for you. There's
Yeah.
obviously a sexual function. There's
Mhm.
a stability function, a support function. There's a sphincteric function. So it's obviously holding in stool or urine, but also allowing those sphincters to open so that you can pass stool and urine.
Right.
It also has a sump pump action. And this is one that most people don't realize, but your pelvic floor, think about it, it collects at the bottom of your torso. So you want your pelvic floor functioning well to help circulate blood and lymphatic fluid. Otherwise, it's going to pool down at the bottom and you're going to get uncomfortable things like vulvar varicosities, which you should
Oh.
do a whole podcast on.
What is that exactly?
Basically, varicose veins in your vulva. Like, not
Oh,
fun.
okay.
And some people are more prone to them than others. That's just one example of stagnant blood and lymphatic fluid, if your pelvic floor is not acting like the sump pump that it can be. And it's even
Mm,
implicated in fertility. So you want to make sure that you're getting good blood flow, as you know, to your reproductive organs. So your
yeah.
pelvic floor has a role in all of this. So we need to make sure, again, that you're training it, but you're also making sure you have full range of motion. You can let go just as much as you can train it up.
Yeah. Oh my gosh. I love that. So let's touch on the Kegel thing and then things that like negatively impact your pelvic floor, because a lot of people will tell you, like, not, professionals in this, of just do Kegels. Like when you're pregnant, make sure you're doing your Kegels to like tighten all that shit up. And I'm like, and I've heard you talk about how like doing Kegels, even if like you're peeing, that could like,
Oh yeah, that's not good. Don't be doing that.
yeah, to not do that, or like pushing, like when you're trying to poop, like things like that. So
Mm-mm.
like, what are these things that we are probably doing that we don't even realize are negatively impacting our pelvic floor, or that some people will tell you to do during pregnancy that are actually
Mhm.
negatively impacting the pelvic floor? Because I think it's so important to know that.
Yeah, yeah. Okay, so Kegels are essentially just a colloquial term for the upward lifting or the contraction of your pelvic floor muscles. And they were named after Dr. Arnold Kegel. Yeah, true story, in the
Of course,
1940s. Of
it's a
course, he
man.
named it after
Of
himself.
course
He's
he
in
did.
there doing an exam and he's like, "Oh my goodness, there's muscles in here. Eureka, I shall name them after myself."
Of
So
course.
that's where they came from. Kegels are just, people get confused. They're like, "What's pelvic floor training? What's a Kegel?" All a Kegel is the term for squeezing, lifting, contracting your pelvic floor muscles. So
Okay.
Kegels aren't complete information. That'd be like saying to you, I want you to go to the gym and just curl your bicep, but not actually teach you how to also straighten your arm, but only bend your arm. So we
Okay.
need to
Wow.
learn how to shorten the muscles, which is a contraction, a Kegel, but we also need to learn how to eccentrically lengthen our pelvic floor muscles.
Mm.
And I'll give everybody a spoiler alert. A lot of us are living around with some degree of constant tension in our pelvic floor muscles. And that can be for so many reasons. It could be for anxiety. It could be a previous history of trauma. It could just be, a sedentary lifestyle when you're sitting all the time. Like there's so many reasons we could
Yeah.
have that tension. The more stressed out we are, we're like dogs. Dogs tuck their tails, we clench our pelvic floors. Same, same.
You don't
So
even
we need to
realize.
yeah. And so we need to work on understanding, are we in a habitual state of clenching? A lot of us are and have no idea. And so this is why it's also important to see a pelvic health physiotherapist. I'm Canada. In
Mhm.
the States, you guys call them pelvic floor physical therapists. We call them
Yeah.
physiotherapists. Same, same. Okay.
Okay. Same thing.
So just to clarify the terminology, a women's health physiotherapist.
Mhm.
It's important to see somebody to help you understand and do brain mapping, like what's going on. You could have knots in your pelvic floor, so to speak, just like you can have knots like in your upper body and in your shoulders.
Mm.
So really incomplete advice is Kegels, because you might already be tense and then
Right.
you get
How do you
pregnant.
know if you are? Like, will you know
Yeah,
if like you are or not?
great question. So
Mhm.
most of us have a combination of tension and laxity. Just like you got, like, yeah, my right shoulder's a little more tight than my left. Like we have
Right.
trigger points, right? So
Mm.
most of us, it's not black and white. Most of us have a little bit of both, right? However, signs that you might be what we call hypertonic, which is fancy for like chronically shortened tense muscles, could be pain. So pain with sex, pain in your
Oh,
low
okay.
back, urinary hesitancy. So sitting on the toilet and like, you're like, nothing's coming out. Like, I know I have to go to the bathroom, but nothing's coming.
Mm.
Constipation. Obviously, there are many causes for constipation.
Yeah.
This could be one of
Especially in
them.
pregnancy.
Oh, 100 progesterone's your friend. Yeah,
Yeah.
exactly. And as you know, and so yeah, those are some of the signs that you could have um chronic tension, hypertonicity in your pelvic floor. But I would
Okay.
say anyone listening to this, assume you have some degree
Right.
of tension. And a lot of people assume that, the word I want to be tight down there. I'm like, no,
Yeah.
you don't. You don't. You want to be functional, right?
Right.
And we hear often the patriarchy saying, "Oh, you want to be tight, like and
Yeah.
that's, I hate those terms to describe,
Mhm.
because a tight muscle is not a functional muscle. So a lot of
Right.
people can actually have leakage, incontinence from being quote unquote too tight.
Wow. Yeah,
It's
you
not
wouldn't want
just
like tight hamstrings. Like you wouldn't want anything
no.
like that tight. Like why would you want that your vagina, your pelvic floor tight? Yeah.
Yeah, well, we think it's because we want to please our partner. My God, the stories
Right.
I could tell you. I've had 18-year-olds say, "Oh, I'm pregnant," and everyone at school is, telling me that I'm going to be ruined, and I'm thinking of planning a C-section
Oh my
because I
God,
don't want to ruin my vagina. Oh
stop.
yeah, in like, but this is
Oh, it's
she
just
was yeah,
ingrained.
yeah.
Oh my
And of course,
God.
you try to take this as an opportunity to say, listen, like, how is it that with male organs, they can swell, think about
Yeah.
it, and come back to their original size? Women, why are women's organs any different?
Right. Right. Oh my God. So real. Oh, I love that. I'm so glad you brought that up. It's so true because it's also like it's a natural thing for our bodies to do. So I feel like
Mhm.
there's so much fear around it. I'm actually taking this like Hypno Babies course right now around like support for a hopefully unmedicated natural birth. Like we'll see what happens, but that's the point of it. Is just like rewiring your brain
Mhm.
around
Mhm.
like pregnancy is normal and safe, and having a like birthing, like your parts are going to be okay, like it's normal, it's a safe process. We were just like so
Mhm.
ingrained for it to be like this like horrific scary type of situation, and have
Mhm.
these fears of like my vagina is never going to be the same, my abs are never going to be the same, like I'm not going to ever be able to recover, which obviously things are going to be different. But I love that you talk about how certain exercises during pregnancy and postpartum can really help with, not just the pelvic floor, but also like what do you call it? Diastasis
Diastasis.
recti.
Yes,
Okay.
diastasis, prolapse, incontinence. So I teach, as you know, a push prep course, a prenatal
Yes.
course, and I know you mentioned you're excited to get into it.
Hmm.
But essentially, it's important in my mind to combine movement with birth education. You can
Mm.
train for a marathon. Birth is much like a marathon. You can train
Yes.
for birth. So there's a lot you can do specifically to not only learn how to release and open your pelvic outlet, learn strategies of how guiding baby down, because your pelvis is curved, and
Mm.
it's important to know how to, do certain movements throughout different parts of your labor to help baby move its way down the birth canal and through your
Wow.
pelvis. So
Mm.
that, but also learning how to manage what we call intra-abdominal pressure. And so, regardless of the birth you're planning, even if someone's like, you know what, I'm more comfortable planning cesarean birth, or I know I want an epidural, or whatever it may be,
Hmm.
unmedicated birth,
Hmm.
it's important to do this work because regardless of how baby comes out, you're going to have to deal with pressure. And
Right.
pressure, what I mean by that is a baby growing in your tummy,
Hmm.
causing your abdominal wall to stretch, causing your tissue to thin and separate. And it's
Hmm.
normal. Everybody's going to have this happen, right? Think
Hmm.
about the middle of your six pack muscle, that vertical midline. It's called your linea alba. Think of that like silly putty. What happens when you stretch silly putty? It gets thinner and translucent, right?
Right.
You with me? Did you play with
Yes.
this as a kid?
Oh,
Okay.
yes. I
Okay.
love silly
Right?
putty.
Or taffy, right? You're pulling taffy, right? You live in Long
Right.
Island. There's a lot of like
Yeah.
fun things to do. Okay, you're pulling taffy.
Yeah.
So it's like
Horrible.
that, right? Right? It's like
Yeah.
that. And so this is connective tissue that is
Hmm.
stretching to accommodate the baby. Normal. It
Hmm.
has to happen. However,
Right.
we can reduce the severity of this phenomenon.
Mm.
There's a lot we can't do. For example, if you're pregnant with triplets, well, you're going to have more stretching,
Oof.
right? Right?
God
Or
bless.
twins. If you have a shorter torso, so you have
Yeah.
less space between your rib and your hip, if you're under 5 feet tall, right? You've got less vertical room.
I
You're
have
gonna have
less
to.
vertical room.
How tall are you, my friend?
I'm like almost five. I'm like 5'1", just
Okay,
about 5'1".
so you're gonna really want to pay attention to the
Yeah.
diastasis stuff
Yeah. But I
because
have so many questions about it already.
yeah, because you probably show sooner in your
Hmm.
pregnancy than someone who's 5'10".
Hmm. Yeah. Yeah. Exactly.
Your bump gets bigger sooner.
Yeah. There's not as much room like for it. Where
Exactly.
is it going to go? So, okay. So this diastasis recta, am I saying that right?
Some people say diastasis, some say diastasis, same. It
Okay.
doesn't matter, like 50
Okay.
50 split.
Same. Perfect. So this is going to happen, right? So that's just like, okay, not to fear, like this is going to happen. Now, I know what you talk about a lot in your workouts is like obviously how to contract and release and like hug the baby and do all of that, which we could talk about like when we talk about exercises. But what I want to talk about is the doming and coning that you talk about, because I won't see that like from a personal example. I won't see that when I'm doing the workouts and I know how to like contract and do all of that and hug the baby, but just like different times of like
Mhm.
certain movements I do, like if I'm getting into bed or whatever, I'll notice the coning happening. Is that something that can totally be avoided, or is that something that's normal to see here and there? Like, what is that about?
So coning is feedback that your body is under pressure, and that pressure has to go out, and that pressure is going to take the path of least resistance. So it's going to
Okay.
go out through that stretched taffy, right?
Okay. Right. So
Right?
it
Because
looks
it's
like
weak.
that.
It's weakened tissue, and it has to weaken because it's under stretch and under force. So if you see
Okay.
coning, it's feedback that your body's like, I'm under pressure right now. So we want to try to avoid repetitive coning in pregnancy, because
Mm.
every time you see that coning, you're putting pressure on that connected tissue and you're encouraging it to stretch and separate more.
Okay. Got it.
So we're
Okay.
trying to avoid a lot of coning in pregnancy. If you see it like a little bit and you're like, oh, I coned, and then it stops, fine. But
Yeah.
it's not, I wouldn't want you like hanging out in a position where you're going to be sustained
Right.
coning.
Okay. So how, right. That's more so like I did some kind of, and I'm so conscious of it now because you talk about it a lot. And I'm like, oh, I don't want this to happen. So now if I notice it, I'm like, oh, like if I'm leaning or doing something in a way that you don't realize like how much pressure your abs actually take over. Like it's crazy. I was talking to my husband about the other day. I'm like, you never realize how much like your front abs actually do until you're pregnant. And like, you just don't want to do certain
Mhm.
things, or you notice that like that coning and stuff. So what are ways that we can, and if, can you explain what it maybe looks like too, for people who maybe don't know, so they know how, what to look out for, and then what we can do
Mhm.
to prevent that doming and coning as much as possible, like maybe from an exercise perspective.
Sure. So that's a big question. I have a whole diastasis recti highlight on Instagram that will
Perfect.
give people, if they are go to the Belle method, check out the diastasis highlight. You'll see images. Actually, I have a video of when I was 24 weeks pregnant with my second, and you can
Oh,
clearly see it. I domed on purpose to see.
okay.
And I also had a student. You can see what it looks like postpartum as well. So
Oh,
lots
it
of
can
info
happen
there.
postpartum too.
Well, you'll definitely still see coning postpartum if you have unresolved diastasis. So
Okay.
yes, you see it postpartum as well.
Okay.
Usually during like a sit-up task, you're sitting on the couch, you curl
Mm,
forwards out of bed, right? So
yeah.
number one thing you can do both during pregnancy and postpartum, if you're seeing that, is to change the way you're performing the move. So for
Mm,
example, you're going to add a breath. So you'll start to do an exhale, hug the baby, and then curl forwards. And a lot of
right.
the times you may notice you don't see that cone anymore. Now at 24 weeks, you can still probably manage it. But
Mm-hmm.
at 35 weeks, you probably want to stop doing it altogether.
Okay.
So the point is that like if you're seeing coning now, curling forwards out of bed, that's an example that you mentioned.
Mm-hmm.
I would actually recommend deliberately rolling onto your side and
Mm-hmm.
pressing yourself up with your hands. We call it like the sexy slide and not
Right.
actually like jackknife forwards. That's why
Right.
we say don't do crunches in pregnancy, because that's what you're
Exactly.
essentially doing. You're crunching forwards out of bed. That's putting outward pressure and downward pressure on your pelvic floor. You can't necessarily feel or see that. But if you're seeing coning, you're also getting downward pressure on your pelvic floor. You're just not
Mm,
aware of it. So
okay.
coning is again, I don't want you to freak out if you see it, but it's just feedback and you're like, oh, okay. Just a reminder, next time, instead of jackknifing out of bed when I have to pee for the third time
Yeah.
at night, I'm going to roll
Exactly.
over onto
Roll
my
over.
side, right?
Right.
You want to baby your tissue in the front of your abdominal wall,
Okay.
and learn to hug the baby, because that's protecting and maintaining that brain muscle connection to
Mm,
your lower abs as they stretch out, which is going to make your postpartum much easier. Not only that, but the muscles that you use when you're hugging the baby, they're called your TVA, your transverse abs. You use these with pushing.
right. Oh, okay. Right. When you're delivering.
Yeah. Yeah.
Okay. Yeah.
And
Okay.
pooping, by
Amazing.
the way. And pooping.
Yeah. It's all that. Yeah. You could, okay. So that's something we could do if like you notice the coning, I guess, like for people who are listening to this, if they experience it, notice what you're doing when you are seeing it, and either like stop doing that, or when you are doing it, do the exhale and hug the baby.
Yes, correct. I mean, a lot of people, when they are hugging the baby, there's a lot to know. So it's not just
Right.
sucking your stomach in, it's not
Yeah.
gripping your ribs. So, I've done some tutorials on Instagram, but we definitely have whole hug the baby labs in the course where people will learn how to actually activate the muscles correctly. And it's important that we're learning to do that work from a low part. So a lot of us are bracers. Like imagine someone, God forbid, but someone's about to punch you in the stomach really hard. What would you do?
Right.
You would typically brace, right?
Right.
Like, like,
Right.
like make your abs really hard.
Yeah.
That is unfortunately how a lot of people are hugging the baby. But if you do that,
Mm,
anyone listening right now, brace, you'll notice that you put downward pressure on your pelvic floor when you do
yeah.
that.
Right.
So that is unfortunately how a lot of people are attempting to hug the baby, but it's actually causing them more issues. with
Right.
downward pressure. So we
You
have
want
to learn.
upward.
Yes, we want to add a gentle contraction of the pelvic floor and a wrapping of the lower abdomen, but then we need to learn how to let that go. Remember, we need to be able to fully release and engage our pelvic floor.
Right. Right. Okay. So, all right. So we know how to do that. So hug the baby when we're doing exercises. Are there specific exercises you would say, like you mentioned, crunching? Like you definitely don't want to do that. Are there, obviously we of course recommend, working with someone for this, but just for like kind of a general statement, are there certain exercises you would definitely recommend avoiding, that could be, putting more pressure on your pelvic floor or making the diastasis recti worse, all of that?
Yeah, in sort of as a rule, we don't recommend full planks after 20 weeks of
Mhm.
pregnancy. And listen, I'm a Pilates instructor. I've been doing this for 20 years. Could I hold a full plank until my due date? Sure as hell could. Did I? No, I didn't. Just because
Mm.
you can, drop the ego. Just because you
Yes.
can, why? So I can prove to everybody I have a hashtag fit pregnancy? Screw it. No, I'm
Right.
going to do
You don't
something that
need
I
that pressure.
know. No, why? Just so wow, look at her. She's holding a full plank. She's so strong. But
Yeah.
I'm also really putting unnecessary additional force and strain on my connective
Mm,
tissue. So
yes.
when you're choosing exercises, we have to drop the ego in pregnancy. Trust
Mm,
me, you can work your butt off in pregnancy, but
mhm.
do it in a way that's going to make your postpartum recovery easier, not harder.
Oh yeah. Oh, yeah. Your workouts are not easy. Like, let's just like they are like they're gentle and they're like effective, but like you feel a burn.
Yeah.
Like they're
Yeah.
definitely not easy. So you could for sure work your butt off without doing that stuff. I agree.
Mhm.
Okay, so no planks, full planks. Anything else?
And again, I want to preface this by saying there are some people who might have been like, yeah, I could totally do planks and I didn't feel pressure and I didn't have coning.
Right.
That can exist. You are the exception to the rule
Right.
after
You're the
having,
unicorn.
well, there is, again, it's going to depend on each person.
Hmm.
But so I don't want someone to kind of come away like anything. There's always got to be individual
Right.
variability here. That you're
Right.
asking me for general rules, and these are
Yeah.
the general rules.
Right.
And then a lot of it has to do with how you do the movement. So
Mhm.
the breath is everything. I actually did a post today on breathing because a lot of people confuse belly breathing with diaphragmatic breathing. So
Mm,
we need to learn to breathe into our rib cage
mm,
and diffuse the pressure. So a lot of us get stuck in pregnancy with this upward hiked like breathing pattern where you're kind of letting your breath your rise up into your shoulders and into your
mm.
collarbone. That's not what we want because if we breathe like that, it basically puts our pelvic floor to sleep and it adds more pressure to our core canister. So
Wow.
we have to start thinking about our abs not as our six pack, but we have to think about this as three-dimensional, right? We've
Mm,
got our pelvic floor, which is part of your core canister. Think of an apple core. It has a bottom, it has a top. Your diaphragm and your pelvic floor represent the top and bottom of that apple. And then you've got your deep core muscles that encircle that apple
mm.
core. So your
Okay.
core is a pressure chamber. Your core is not your six pack. So our breathing mechanics have everything to do with how well we manage pressure in our core canister.
Mm,
So any exercise can be made an amazing exercise if you're breathing correctly, but almost any exercise can also be really shitty for your pelvic floor if you're holding your breath or you're bearing down or you're doing like a Valsalva, right?
right.
So again, instead of me saying these are the checklists of do's and don'ts, I'll do that for a full plank, sure, but I
Hmm.
can't do that for a variety of other exercises because again, it's going to depend on how that person's breathing.
Right. Okay. So breathing is what's most important and learning how to on your exhale to hug the baby and on your inhale to release and doing that at obviously specific times when you're doing certain movements.
Yes, and we also have something called active core breathing, which would be an example of when you need to maintain a core connection. So
Right.
scenario being, I know you're probably like me. If you're bringing groceries in from the car, you don't want to make 3
Yes.
trips. You're going to take all those groceries and like 5 in one hand, 7 in the other, and you're like pregnant. You're like, screw it, I'm doing this in one trip. Well, that's when you're going to need to use active core breathing,
Yes. Okay.
right?
I've
Because you
been doing
can't,
that.
because you can't release, right? You're going up a flight of stairs, you're carrying all your stuff.
Right.
So there are scenarios where we have to sustain a hug of the baby while
Hmm.
performing a movement, right? So
Yeah.
we do a combination of regular core breathing and active core breathing.
Okay. Amazing. And then what about if so full plank, you're saying no, is like downward dog, we wouldn't consider full plank, like that would be fine type of situation. for
Yeah, I mean,
exercise?
we can do a downward dog in pregnancy for sure. That can also be useful for, we do forward leaning inversions to help rotate breech babies. So there are
Right.
always, that's not quite the same as a downward dog because you don't get the same release of the uterosacral ligament. I'm getting a
Okay.
little nerdy here for everybody, but
It's all good. We love it.
the point is that yes, it's fine. Do we spend in our classes like a long period of time in class in downward dog? No. But
Mhm.
if you need to go into downward dog and then move forwards, yeah, that's fine. But
Right.
it's not like a power or vinyasa flow class where you're
Yeah,
going to
yeah,
be doing
yeah.
chaturangas and vinyasa flow.
Yeah,
We're not
yeah.
doing that.
Definitely not doing chaturangas anymore. Um, okay, perfect. So, I want to get to postpartum recovery in a second, but I just want to wrap this up first of what are the like I remember you did a reel of like 4 things that are putting pressure on your pelvic floor. We talked about Kegels. In there you mentioned like going to the bathroom and pushing. Like what are like some of those major things that people might be doing during the day? That I just wanted to circle back to that because we didn't finish out that conversation that could be putting unnecessary pressure on their pelvic floor and like are easy things that they could just like stop doing.
Totally. Okay. So first of all, we don't want to rush pee. So
Mm.
I'm a recovered rush peer where you're
Yeah.
like, I don't have time. I'm just going to quickly pee. And you kind of like push as you're peeing to
Yes.
speed it up. Don't be doing that because
Mm.
that's more associated with prolapse, especially cystocele, which is bladder prolapse or urethral prolapse. Prolapse is the
Okay.
name for when your organs start to descend down.
Mm.
And these are the lower sort of reproductive organs, your uterus, your bladder, your rectum are the main
Okay.
3 kinds of prolapse. So we don't want to have prolapse. 50% of us develop prolapse in our lifetime.
Wow.
Okay. Yes, it's a very common issue
Yeah.
because we're bipeds. We have to resist against gravity. And the
Mm.
more vaginal deliveries we have, the more likely we are to sustain prolapse. So, a
Wow.
lot of this pressure management that we talk about through exercise, as well as the pushing techniques, my friends, do not be pushing
Mhm.
for hours with your legs in the air on your back. That
Yeah.
is a
Oof.
huge one. We know that if you're pushing for longer than 50 minutes, 50, it's correlated with prolapse. So,
Wow.
there are a lot of things that we can do to reduce the heaviness, the hemorrhoids, the incontinence,
Mm.
the prolapse, and a lot of that has to do with learning about better options for pushing, positions, techniques,
Oh,
breathing,
we're
all that
definitely
kind of
going to
stuff.
talk about that. So we'll
It's a
circle
little
back to
long
that.
for one. It's a little long
Yeah.
for one podcast. There's like
Yeah.
an 8-week course on it, but
Yeah.
yeah. So anyways, back to your original question, what are some easy
So
things that
not
you can do?
rushing to pee.
Yeah, don't rush to pee. Don't practice Kegels on the toilet. And a lot of
Mm.
us were taught, oh, what's a Kegel? Just hold the flow of urine and then you're
Yes.
working your pelvic floor. That can
Hmm.
actually create like a negative biofeedback loop where you're sort of sitting on the toilet and then that can develop hesitancy. So you want to associate the toilet with a place of letting go. You don't want to
Hmm.
start confusing your brain and starting to Kegel and hold when you're actually on a toilet trying to release.
Right.
So you don't want to be practicing on the toilet for that main reason. We don't want to be peeing just in case. That's another one.
Mm.
So a lot of us sort of like, especially postpartum, if you've dealt with leaks, you sort of always want to keep your bladder empty because you don't want to have an accident.
Yeah.
And so we want to avoid that because you can develop overactive bladder, where essentially there's a muscle around your bladder called your detrusor muscle, and that can get angry,
Mm.
irritated, overactive, and it starts to contract even when your bladder's not full. And
Wow.
so, if you're peeing for less than 8 Mississippis, so count the flow of urine, one
Ooh, okay.
Mississippi, if you're peeing for less than 8 Mississippis, your bladder wasn't full. And you might need to
Wow.
go into like bladder retraining program.
I notice myself doing this because I have to pee so often. And if I'm like going for a long walk, I'm like, let me just pee like before I leave so I can just like not have to worry about it if we're going on a long car ride or something. So, and then I obviously follow you on Instagram and I'm like, okay, I'm not going to do that because I don't really have to pee yet. Like I'll just pull over, squat on the side of the road, like
No,
literally.
no, no. Well, when you're pregnant, it's a little different because
Yeah.
I'm speaking more to the postpartum
Oh,
people here.
okay.
But when you're pregnant, you have more obviously pressure on your bladder. So it's normal
Yeah.
that you're going to pee more frequently because there's less room for your bladder to expand, especially
Right.
as your pregnancy progresses. Also, hormonal, like there's more fluid going around. So you are going to pee more frequently. but especially postpartum, we don't really want you peeing more frequently than every sort of like 2 to 4 hours. So if you're
Okay.
peeing every hour, if you're peeing just a little trickle,
Mm,
if, you're trying to like, you're fumbling to get the key in the door and you're running to the bathroom and you don't quite make it, that's
mm,
urge incontinence. So there's so many different kinds of incontinence.
yeah.
It's not just, oh, I'm peeing because I'm laughing or sneezing. There's also peeing because you've got this urge to pee all of a sudden and you don't quite make it to the toilet. So there's urge
Mm,
incontinence as well as stress, urinary incontinence, and
okay.
overactive bladder, all these things.
Okay.
So there's a lot in there. So I just want to make sure that like everyone understands you don't just all of a sudden develop a small bladder postpartum.
Right.
It's likely that you've got some overactive bladder issues.
Okay. Okay. Amazing. So no Kegels on the toilet, no rushing to pee, or like, yeah,
Yep.
pushing it out to pee, and then no peeing just in case.
Mm-hmm, mm-hmm, mm-hmm.
Um, and then what was, oh, there was another one of not, like if you have to go to the bathroom, not like forcing yourself to like have to poop.
Yeah, you don't try not to strain,
Mm-hmm.
especially when you're pregnant, because you already have
Mm-hmm.
enough downward pressure on your pelvic floor, right? Remember that visual of a watermelon on a trampoline?
Yeah.
So
Yeah.
if you're pushing down, again, that's also related causally to both prolapse and diastasis, because
Mm.
you're adding unnecessary strain and pressure. So get yourself a squatty potty if you don't already have one.
Oh, it's the best.
Right? Elevate your feet, opens your pelvic outlet more, opens the pelvic floor, allows you to do what you've got to do. And if you still, even with a squatty potty, if you're still just like, oh, it's not quite coming out, don't force it. Right.
Mm.
I know you talk about constipation. So,
Mm-hmm.
more fiber, 30 grams a day, more
Mm-hmm.
water, right? Doing what you got to do, but don't force yourself to go to the bathroom. Don't strain, especially in pregnancy and postpartum.
Yeah. Okay. Amazing. So if there were, before we just get into postpartum, if there were three things that you were like, focus on these three, obviously there's so much more, but focus on these three things to help support your pelvic floor through pregnancy, what would they be? If someone's just like, okay, where can I start like focusing on most?
Well, first of all, you need to understand the core mechanics and you need to learn to breathe better. So you need
Breathing.
to
Okay.
understand like what's diaphragmatic breathing. If you're having a hard time sensing that your ribs can expand like an umbrella when you inhale, then you need to figure out ways to get that mechanism going. So improve your breathing mechanics is number one. The next thing I would say would be once you figured out the breathing, start to connect better with your pelvic floor. And it's sort of like in our classes, we call it the ABCs, alignment, breathing, choreography. So you need
Yes.
to first work on your alignment. So stack ribs over hips, right? Get that nice connection going. Once you're aligned, then you'll get better breathing mechanics. Once you have better breathing mechanics, you'll actually get results from the choreography. But if you
Mm,
skip right to the choreography and you don't first address your alignment and your breathing, you're not going to get the same results.
love it. Oh my gosh, so good. Okay, so breathing, alignment, and then choreography. Those are the three things to focus on.
Yeah, alignment,
Alignment,
breathing,
breathing, choreography.
choreography.
Right.
Yes.
Okay. Amazing. Okay. Love that. So, okay. Postpartum recovery. Obviously, I mean, there's so many things that you could go into for this, but I know someone, like I'll just speak for myself in this stage of life that I'm in, things that will go through my head of like, okay, postpartum recovery is again, like when can, obviously, you'll speak with your doctor and stuff, but like, what are the types of movements that you would recommend postpartum, and like how quickly can you start doing that stuff? Are there things that maybe aren't fully exercise related that we can do to help support our pelvic floor and support that recovery quickly after baby? Like what does that look like?
So it's going to depend on how you deliver. So if you
Okay, that
have
makes sense.
if you have a cesarean, it's going to take longer. That's major
Right.
abdominal surgery. They're cutting 7 layers of tissue. So
Right.
people think of this as like, oh, I just know it's major freaking surgery. So you're
Yeah.
going to need to add likely an extra month of rehab time on top of these timelines. If I were to give you timelines for the earliest after an uncomplicated vaginal delivery,
Hmm.
add at least a month if you've had a cesarean birth. We
Okay.
also want to deal with if you've had an episiotomy, if you've had second degree tearing or more, right? If you've had a third or fourth degree tear, again, that's going to take longer for recovery than if you've had second degree tearing or less.
Mm,
So we have to qualify this. There is no
right.
sort of like easy guideline. It's going to completely depend on how you're feeling, how your
Mm,
delivery went, how much support you have. How's your body? Did you have postpartum hemorrhage? Add more time there, right? You're going to be anemic. You're going to be dealing with all this. Do you have any issues with breastfeeding?
Right.
Is your baby in the NICU? So
Mm.
there's so much to consider here.
Yeah.
So I preface this all because I don't want anyone saying, and sometimes I recognize this when I shared a post recently that triggered some because it was what I did at 2 weeks postpartum. But I
Mm.
had an uncomplicated vaginal delivery. And I
Mm-hmm.
said, this is going to vary, like add time. But sometimes people can be like, that's completely way too soon. Well, it
Right.
could be too soon for somebody, but
Totally.
there's other people that it could be totally fine.
Right.
Right. So
Right.
again, I also need us to talk about the fact that there's nothing special that happens at 6 weeks postpartum.
Mm.
So please, anyone listening to this, do not wait 6 weeks and then get arbitrarily, and it is completely arbitrary, cleared, and I'm using air quotes, at
Mm.
6 weeks postpartum, and then get cleared to do exercise and then decide you're going to go for a run with your stroller. That's
Yeah.
just plain idiocy. Do not
Right.
do it. Okay. Because
Mm.
you just don't do it. You need to work on gently restoring your connection. So there is so much we can and should do in the
Mm.
first weeks before your quote unquote 6 week checkup that you
Right.
can do to rebuild that brain muscle connection
Okay. And what are
versus
ways we could
doing
do that?
nothing. Breathing,
Yeah.
ABCs, alignment,
Mm.
breathing, choreography. Like in
Mm.
the videos, I have free guides on Instagram where you can go and see what I did weeks 2 weeks postpartum, 3 weeks postpartum, 4 weeks, breathing, bridges on your living room floor, some gentle
Mm.
stretches, right? Some cat cows, some
Mm.
thoracic mobilizations, maybe a modified bird dogs. There's so
Right.
much that we can do. When we say workout, it's like breath work with gentle mobility work. We're not doing jumping jacks, friends, right?
Right. Right.
Like
Right. You're not running a marathon,
we're
but
not running a marathon.
that's
No.
good to know that like even breathing like is something that's so important that you could focus on postpartum
Yes.
that can really help with the
Healing.
rebuilding and with the healing and all of that.
Yeah,
Yeah.
the healing, 100%. And people are often, if it's their first baby, they're surprised at sleep deprivation. It's
Yeah.
real,
Oof.
right? Hormonal fluctuations are massive. We don't ever have
Yeah.
this great of a cascade of hormones at any other point in our life that's so sudden. So your
Yeah.
mood is going to be all over the place. You might be having hot flashes, night sweats because of all the crazy stuff going on.
Mhm.
So you're probably not going to feel even remotely wanting to do anything possibly
Yeah.
for at least 2 to 3 weeks, and that's fine. But
Mhm.
just don't do nothing and get cleared, because the vast majority of us don't get any type of proper pelvic floor assessment at 6 weeks postpartum.
Mhm.
Some of us don't even get our stitches properly checked. And then it's
So
like,
bad.
here's a script for birth control, off you go, right? Like
Mhm.
we're not.
Oh,
So
don't get me started.
manage your expectations, right? People are, oh, I'm going to go get cleared. I'm like, everybody, do you know why we have a 6 week? Do you know why it's 6 weeks?
Why?
It takes 6 weeks on average for stitches to dissolve. That's why.
That's the only reason.
Yep.
Oh my
There's
God.
nothing
So
magical about
ridiculous.
6 weeks, right? It's
Right.
not like all of a
There's
sudden
scientific like
you've
evidence
done,
about it.
no, you've done nothing for 6 weeks. You go to the doctor, now you're cleared, and now you're like, go have sex,
Yeah.
go for a run. Like,
Right.
absolutely not. You
And
need
I
to
wonder
get
why
your body ready
people
for that.
are like struggling with the incontinence, with all this stuff after. If that's what the mindset is, it's like, well, obviously you're going to struggle then. Because if you just were listening to what your doctor said, because that's what we're told. I mean, like if people don't have this information, it's like, oh, okay, well, I'm not doing anything. My doctor said now it's good. So like, I'll start now. Like this is just what
Right.
people are told to do.
Yeah. And it's unfortunate because then there is this, I'm going to do nothing because I'm afraid and I want to be a good patient. I want to listen to my doctor. Then I'm going to
Yes.
go get quote unquote cleared. Then I was cleared. It's fine. Now I'm going to go have sex. My husband want whatever.
Yeah.
And that hurt. There must be something wrong with me.
Oh,
Or I have to just suck it up and, have some
do
wine
it.
or whatever.
Yeah.
Right. Or
Yeah.
I'm going
Yeah.
to go for a run and oh my God, I peed my pants. Something, maybe this is just motherhood now. Well, yeah, because you haven't
Yeah.
freaking restored your core at all. And we know from
Right.
the research, you shouldn't even be running until at minimum 3 to 6 months postpartum. And there's research on
Wow.
that, but people
Wow.
don't know,
Yeah. And you have a course for postpartum recovery as well.
obviously.
Yeah. Okay. I'm like, let's just make that clear because I think that that's like so, so important because there's no, when people are going to traditional doctors, OBGYNs, all of that, there's absolutely zero information about that and zero care about like how to actually support yourself, not just during pregnancy, but also
Mm-hmm.
postpartum. So of course, we're going to put all of that in the show notes and stuff as well. Um,
Mm-hmm.
so, okay. One other thing I really want to just touch on, and I know you have a whole nother course on this, but this is something that of pushing on your back, right? That's like a normal thing during if you're having a vaginal birth. I recently was my 20-week checkup, I was talking to my OBGYN. I'm having a doula as well. But I told him, I said, I does the hospital have birthing chairs? Like I don't want to push on my back. Are there other options? Like whatever, talk to him about it. And no joke, what his response was that it's easier for him if you birth on your back, because if you're not, he'll have to get into like a weird position to like get the baby out. I was
At
like,
least he's honest. At least he's honest.
I couldn't believe my ears. I was like,
Yeah.
I don't care. Do you think I care if it's easier for you? Like I'm the one who's pushing a baby out. I couldn't believe his response. But anyway, the point of this is, what are the reasons why we don't want to push on our back? And what are the benefits of maybe pushing in other positions if someone is going to have a vaginal birth?
All the benefits.
Yeah.
So let me tell you this. So it is how they're trained. Okay.
Yeah.
And it's slowly, hopingly, that's not a word, hoping. I get flustered because it makes me so mad. It's like,
I
but
couldn't believe that response.
you're in your sacrum. So for a little bit of anatomy, your sacrum is the area, it's the spade-shaped bone just above your tailbone. Okay.
Mm-hmm.
When you're on your back, your sacrum cannot move. And I've got videos on my account to show you this. If you're on your back,
your Instagram is like the best. You guys have to go follow.
There's a lot there. Your sacrum can't move. And so this is also why we hear a lot of stories of people breaking their tailbones during birth or having chronic tailbone pain postpartum or pushing for a really long time. So a couple of things. When you're lying on your back, your sacrum can't move. Your pelvic outlet's closed by an additional 30%. So it's harder to get the baby out. You're more likely to have tearing. You're more likely to push longer. And you're pushing against gravity because your pelvis is curved. So you actually have to push the baby down and then up around your pubic bone.
Sense. Yeah.
So it does take longer. It does result in more issues with your pelvic floor typically. We do have tricks and tips if for whatever reason you want to be on your back, especially people who've had an epidural will tolerate it. If you haven't had an epidural, it is excruciating to lie on your back to push.
God.
I can speak from experience. So if you, again, we have tricks and tips. You can use a towel. There's ways you can create a bit of clearance for your sacrum and your tailbone if you're on your back. But generally speaking, especially with an epidural, if that's something that someone wants to choose, you can be on your side with a peanut ball. And it literally all the doctor has to do is turn their head slightly to the side to see.
Yeah.
It's not like you're asking them to go crazy.
Yeah.
But it is really a good idea to have conversation with your care provider beforehand and like you did, to say, this is important to me.
Yeah.
At the end of the day, I want everyone to know this. And we have a whole class on self-advocating. Nobody can force you to be on your back.
Exactly.
You can decline. And they might say, you have to get on your back. You have to get on your back. The doctor's here. We have to, and if you're unmedicated and you're doing well and it's in your birth plan and you're like, I want choice over my birth position. It's written in the ACOG, the American College of Obstetricians and Gynecologists, and the SOGC for those of us in Canada, that patients should have autonomy and choice over their birth position. It's freaking written in their charter. So they cannot force you to A, hold your breath if you don't want to hold your breath, and B, be on your back if you don't want to be on your back. And you just have to know your rights and you have to just stick to it. And it's hard when you're vulnerable and it's hard when you're in the middle of birth and you're sort of you're unsure. But if you're doing well and the pushes are working, there is zero reason that you need to be moved to your back for the convenience of the person catching your baby.
Exactly. I was like, oh, it's hard for you. Are you serious? I just can't even believe that he actually said that. So what are some positions that you would recommend then? I know you said if you can go on your side if they have an epidural, but even like with, I guess, say without an epidural, what are like your top positions that you would say would be? What is it? Hands and knees. Hands and knees. Okay.
Yeah.
Okay.
So there's so many, right? Birthing balls, supported squat, like again, so many.
Yeah.
Beyond the scope of what we can talk about today, like so many props you can use. But I would say the vast majority of people who are pushing would, especially if they're unmedicated, would elect hands and knees. So hands and knees is usually like leaning over the back of a hospital bed. If,
Okay.
if you're in a birthing pool, you could be leaning over the side of a birthing pool. A birthing pool might be a little different because you're in a more of a weightless environment. A lot of people in a birthing pool would be lying back and pushing, and then they wouldn't
Okay.
have their bum touching the ground as much because they're
They're
floating in the
floating.
pool.
Okay.
But in a hospital environment, hands and knees, leaning over the back of a hospital bed, it's a completely sacrum free position, and you're using gravity to help you
Mm,
versus being on your back having to push up against gravity.
right. Okay. Amazing. I love that. I love the advocacy piece of it. I love like I do think it is important to talk to your doctor again beforehand because like you said, it's going to be hard to have that as first conversation when you're in the heat of whatever is going on, especially if it's your first birth and like you don't really know what to expect. So that's amazing. So okay, can you let everybody know what different courses you have if someone is prenatal, where to go, like if they want to learn about postpartum? Like I know you have so many different offerings. So can you let us know what they are and who they're for so they know like where to be directed?
So I'll just recommend one course for pregnancy. It's our push prep course. It's our most
Perfect.
popular one. It is the one that, you don't have to join live. We've literally supported women from all around the world, every
So
country,
amazing.
thousands, hundreds of thousands of people now almost. And
So good.
it's pretty powerful. So that's the course I'd recommend. Starting it sort of in the earlier part, like ideally around 20 weeks. You want
Okay.
to start it because there's a lot of content. You want time to absorb it.
Yeah.
That said, we're putting together a flow. So if you are like 36 weeks and you're trying to do it in a crash course of 4 weeks, we're putting together that sort of just a little kind of sequence where probably need to budget 3 hours a day for that. But
Okay.
again, if you start it earlier in your pregnancy, you'll have time to get through it. So it's a combination of classes, as well as live Q&As, as well as like
Amazing.
tons of on-demand workouts and expert interviews and printables and things to work through. And then after
Perfect.
that, we have a postpartum course. It's an 8-week postpartum course. And that's where you're going to, same format. There's a dashboard you log into, there's live classes, there's Q&As, and it's movement plus education.
Amazing. And the birthing information is in the push prep course, correct?
Yes.
Okay.
Yes.
Okay, perfect. So I will put both of those in the show notes. And I know that you are offering code for our listeners for
Mm-hmm.
10% off either of those courses or one of those courses.
Yeah, you can use the code once. So
Okay.
whatever one you
Whichever
can
one you
use,
want.
whichever one you want. And
Perfect.
it's called, well, I have a podcast called We Go There.
Oh,
So
amazing. I love that.
it's called, the code is people are, why is this code called We Go There? It's because of my podcast, We Go There
Yes.
10.
Amazing. So
Yeah.
I will put all that in the show notes. So you could use that. We go there 10. That's so amazing. Thank you so much for 10% off of any of her courses. Obviously, go check out her podcast. We go there. I'm also going to put a link in the show notes for a free 30-minute prenatal webinar that you have.
Mm-hmm.
Your Instagram. I mean, there's so many resources. Obviously, we can't cover everything in one podcast episode, but I hope that this just like really allows people to see that like there's so many things you can do during pregnancy to support birth, to support your postpartum recovery, and that these things that we hear all the time don't have to be normal, and that you can do things to change them. So I so appreciate all of your expertise and your time with us today. Is there anything that you would want to just leave the listener with before we wrap it all up?
I want to say that, two things. Number one, if you're pregnant right now, just remembering that we will always remember how we were treated in birth. So birth can either be one of the most empowering events of our lives, or unfortunately, one of the most traumatic. So the
Mm.
more you can prepare yourself, the more you can build a care team, the more you can feel educated and armed with evidence, the better able you'll be to advocate for yourself.
Oh,
Number
love
one.
that.
And when it comes to postpartum, I also want to say that it is never too late. I'm often,
Mm.
people reach out and they say, you know what, it's been 3 years and I'm still dealing with this and it's too late for me. And it's like, no, it's not. Give
Mm.
yourself some grace. If it's been a hot mess, right, for the first little while, it's okay. You can
Yeah.
always start anytime. It is never too late to improve your core function.
Oh, I love that so much. Thank you so much. And please, if you enjoyed this podcast, if you know someone else who's pregnant or postpartum, please share this with them. The best thing you could do for our listeners is to share that for our, not listener, for our guest, for Nikki, is to share this on Instagram, tag at the Belle Method, which is in the show notes, tag me, let us know what your biggest takeaway was. It's so helpful for us to see what you actually were learning and taking away from this. So I appreciate you, Nikki, so much for everything that you do. Thank you for your time. Thank you for offering these courses, all of it. I know that I'm excited about them. So I know my community is going to love them as well. And I really appreciate you.
I'm happy to be here and excited to support you too.
Yay. Thank you so much. And everyone, I will talk to you next time. Have an amazing rest of your day.